And that is where gelsimium comes very close by. We have entered what is known as a phase of exhaustion. What is this exhaustion phase? This exhaustion phase is a phase where, we have put down our defenses now. Now you will see most of the people walking on the road without any masks. So there is a burnt out phase. We have already burnt out ourselves. Now we have given up. Now we are saying, okay. Now that exactly is the state where gelsimium comes in. So gelsimium location is mucous membranes, nose, gall ducts, circulation. It affects the occipital level is the basic level where, location where gelsimium has its more action. The base of neck, motor nerves, muscles, knees, eyes, eyelids, vision is where gelsimium has its sphere of action. And the causations are gelsimium phase comes out of depressing emotions. Like the 5 to 6 months that we have gone through depressing emotions. There are a lot of bad news that we have gone through. So there, it is a bad news, a fright and anger too also is there. And there was all this damn weather. So last 3 to 4 months, there was a phase of everything coming around. And that was actually the whole, it's like, water, soil, and sunlight, everything coming, and the seed is going to grow around. So that's where, the gelsimium understanding comes through, that the causations are depressing emotions, fright, bad news, anger. There are hardly any good news that are coming through in this span of time. The modalities are aggravated bad news when thinking of his ailments. Last time we saw thinking of ailments ameliorates, and it was camphor. Gelsimium has thinking of his ailments aggravates. And if somebody has even nowadays there was a WhatsApp joke which goes around that even if I sneeze, people make a distance out of me. So if somebody gets a little sneezing, one starts thinking that it's now going to go into the COVID-19 disease. So thinking of ailments then gets back again to emotions, which again brings about a bad phase, which again goes into. There's a dread. Actually, people dread this particular illness. So a dread feeling of apprehension. So any slight complaint, like yesterday, I had somebody, everybody in the family was worrying about that. Doctor, what is it? So there is an apprehension coming through. The ordeals that we have gone through into this particular span of time. Now, these are all the features which Hans Selve says comes in the stage of exhaustion. When spoken to of his loss, 10 a.m. aggravation. These are the aggravations of gelsimium. The ameliorations are profuse urination, sweating, shaking, bending forward, mental efforts, stimulants. People have gone to have, I think, maximum amount of sale of liquor has happened around in this span of time. And somewhere there is a joke which goes around. I don't know whether you are familiar with it or not. But they say the economy has survived only because of Indian economy has survived because of the drinkers. So stimulants tend to ameliorate all those things. Continued motion, and we see how people are just now wanting to just move around and just break around and got to have anyone near her, even if the person be silent. This is one of the very important features of gelsimium, that they don't wish to be spoken to or have anyone near. They want to be alone. Apathy, this could be probably social distancing at its peak. Apathy about illness. That's what I talked around, that we have now come to an apathy about that particular thing. A dullness, a languor, a listlessness, there is a weakness, prostration that has come around. The restlessness is there, anticipation, fear, fright, exciting news leads to physical ailments. Fear that unless one move, heart will stop beating. That is where again comes from continued movement. That unless something needs to be done, otherwise, this particular thing can also be understood from that, how are we going to live if we don't work? So we have to start doing. So now we have started doing in that particular phase. The physicals are dullness, drowsiness, dizziness, trembling. There are eyes or visual effects and polyuria. One or two of these symptoms usually accompany most of the disease condition in which gelsimium is indicated. So you will find gelsimium, if gelsimium is there, this out of these 5 or 6 symptoms, 1 or 2 will be definitely there. It will be dizziness, drowsiness, dullness, trembling, visual symptoms, or polyuria. And one of the important aspects which we talked of, how we are talking of the exhaustion phase, is there is muscular weakness, aching, tiredness, the extremities. So there is a lot of weakness, soreness, and tiredness and aching that is felt in extremity muscles. In fact, one of the commonest feature which probably is very important also as far as COVID-19 is concerned is one of the things that happens around in COVID-19 is what is known as Landry's paralysis, or it is also known as Guillain-Barré syndrome. Now, one of the commonest presentation of Guillain-Barré syndrome or Landry's paralysis is what we find in Gelsimium. You know, the general thing is, and then it moves up. Generally, it is post viral infections, and in COVID also one finds that patients can be subjected to this Landry's paralysis or Guillain-Barré syndrome, as they call it. And in that, the first thing that starts off with the weakness or the paralysis, paresis actually. There is no complete paralysis as such, but there's a paralysis of paresis is there, and it starts from the extremity. COVID-19. So tremors or twitching of single muscles, face, tongue. There is dull, heavy or bend-like headache around the occiput. Heavy drooping eyelids, usually thirstless. That Gelsimium everyone knows is usually thirstless. But there will be thirst at sweat stage. During the sweat stage, the patient will be thirsty. So the confirmatory symptoms are of gradual onset. So that is where actually even Landry's paralysis, there is the important maybe complication is when respiratory muscles gets arrested in Guillain-Barré syndrome. That's where the patient die. Otherwise, the patient will 100% recover. It's only when the respiratory muscles get affected, that's the time. So there is a gradual onset of complaints, and that's exactly what happens in Guillain-Barré syndrome. There is apathy regarding his illness. The dullness is there, dizziness, wants to be quiet. Complaints from anticipation, guttural complaints. Tongue is heavy, numb, trembling when protruded. Speech is thick, can hardly speak. Because of the paresis state of the tongue also, the speech becomes very thick, and paralysis with complete prostration and relaxation. That would be Gelsimium. There is lack of muscular coordination, weakness and trembling, chill without thirst, especially along the spine, running up and down the back. This is one of the very important indication of Gelsimium, where the chill runs up and down the spine, and he wants to be held because he shakes so much. And one of the other important aspects is never well since flu. So, as I told you, any post-COVID complication, Gelsimium is one of the very important remedies. So, exhaustion and post-exhaustion phase, Gelsimium is the remedy. So, what are the COVID symptoms that you can come across in mild and moderate cases? There is acute coryza with dull headache and fever, flu-like symptoms, fever, headache, dizziness, and general weakness. But there is some thin, acrid water discharge from the nose. And Harvey Farrington says that no other remedy has cured more cases of La Grippe or endemic or epidemic influenza. So Gelsimium seems to be one of the commonest remedy that is being used in epidemic or endemic influenza. And in severe cases, there will be slowness of breathing, great prostration. As I told you, respiratory muscle paralysis, which if they happen, then there will be, breathing will get slowness of breathing is there. There is hot, heavy, flushed face, hot to touch, spasms of glottis. There is a long crowing inspiration and sudden forcible expiration, which actually happens when your muscles are weak around. So there will be a very long inspiration followed by a sudden forcible expiration. So that is Gelsimium. A feeling as if it is necessary to keep in motion, or else heart's action would cease. Pulse is soft and weak. Generally, you find those who are having a pre-morbidity of heart affections, will have some aspects of weak. There is a gradual. Now we come to the next remedy, that's Carbo Veg. The location is, the sphere of action of Carbo Veg is heart, venous, circulation, blood. One of the commonest also other who are in that particular feature. And aggravations are warmth, loss of vital fluid, depletions, exhausting diseases. And COVID-19 we have seen is a very, very exhausting disease. We have been here for 6 months. There's a lot of exhaustion that we have come across. High living, rich food, decayed food, which we already saw. Ameliorations from eructations, elevating feet, cool air, fanning. And the mind is anxiety, especially in the evening. in bed, twilight time, closing eyes. This is the time when anxiety, fear sets in. Because twilight is a phase where, one doesn't know, the darkness has not come up and the light has not gone away. So that's the phase where, it's an in-between phase. So similarly, COVID-19, there is a lot of people who are in in-between phase. They don't know what's the outcome going to be and how it's going to turn out. So there is fear of ghosts, of people, of accidents, aversion to darkness, indifference, hears everything without pleasure or pain, peevish, irritable, inclined to anger, confusion, which makes thinking difficult in morning, on rising, better mental exertion. So there is a confusion state that has come around, and this we had probably seen through when we talk of that. Confusion happens to be one of the guiding indications of pneumonia, and based on that, we can understand whether the patient has to be treated inpatient, outpatient, or admitted. If you probably recollect the CUP 65 criteria of it. So Carbo Veg has physically weakness, flatulence, fitter, and air hunger are present in most complaints. There is want of susceptibility to well-selected remedies. It is suitable to atonic conditions where there is lack of reaction. So such phase where there is reaction not coming up, selected remedy is not working well, Carbo Veg is to be thought of. In the last stage of disease with copious cold sweat, cold breath, cold tongue, and loss of voice, the remedy may save life. And we have used Carbo Veg in terminal disease where patient has shown good response. We also talked of arsenic also was one of the remedies where well-selected remedies failed to work, or in the terminal stages of diseases where pain is there, arsenic can relieve the pain. So arsenic Carbo Veg come very close by in that particular frame. But arsenic Carbo Veg is cold and wants air to be fanned. There is a thick acrid discharge. The tongue is cold, black, swollen, covered with white, yellow-brown mucus. Confirmatory symptoms are cold, patient chilly, but wants air to be fanned. Thirst for cold water. There is icy coldness, unilateral, of tongue, knees, legs, foot at night, and there is internal burning heat, just like arsenic, coldness with internal burning heat. But it's not that prominent as it is in arsenic. The patient may be lifeless, but the head is hot. Coldness, breath, cold pulse is imperceptible, oppressed, and quickened respiration, and must have air. Must be fanned hard, must have all windows open. And in COVID, mild COVID, there is coryza in warm, moist weather, hoarseness, which is worse in evenings, rawness in larynx from frequently clearing of the throat, and rawness requires to be frequently cleared up because of the rawness feeling that is there in the larynx. In severe cases, cough and burning in chest, spasmodic cough, there is bluish face, offensive expectoration, neglected pneumonias, destructive lung diseases. Last stage of diseases with copious cold sweat, cold breath, cold tongue, voice lost. I had one case of pneumonia recently, which was not improving. It improved to a certain extent, and then the patch was not going around. And there are cases which keep coming around of this neglected pneumonias. So what is been written in our books, when you encounter, then you understand. But in that case, Carbo Veg symptoms were not there. So, I had to give some other remedy. And then the patient totally recovered out of that particular. So unresolving, neglected pneumonias that are there, it does not completely resolving. So last stage of diseases with copious cold sweat, cold breath, cold tongue, voice lost, you come across the indications of Carbo Veg. Now, to see the comparative study of Gelsimium and Carbo Veg, the important features of Gelsimium are dizziness, drowsiness, dullness, trembling, eyes and visual effects, polyuria, patient is thirstless, damp aggravation, does not wish to speak to or have anyone near her, even if the person be silent. It's right-sided. Gelsimium is right-sided, like arsenic. And it has a 10 AM aggravation. Carbo Veg, on the other hand, has important features of weakness, flatulence, fitter, air hunger, wants to be fanned, immoderate thirst, warmth aggravates, anxiety, especially in the evening, in bed, twilight, closing eyes. And Carbo Veg is generally useful for old age patients. In fact, one of the important indications of Carbo Veg is its usefulness in old people. And Carbo Veg has aggravation at night before falling asleep, just when the patient is about to. So that's the difference between Gelsimium and Carbo Veg. So we had looked through arsenic, camphor, Now we finish Gelsimium, Carbo Veg. Now we come to relative class understanding of all the four remedies that we have just done it today and the last class, so that we finish off with these four remedies. Now, what is common between all the four of them? So there is weakness, prostration, coldness. This is common in all the four of them. All the four of them have weakness, prostration, coldness. Gelsimium, Carbo Veg, Camphora, Arsenicum. But the coldness in all the four is very different. Gelsimiums have the a chilliness that is going up and down the back. That's very important. And because of that, they shake. And that's why they have to be held. They have to be held around. Whereas Carbo Veg, there is coldness of the body, but you'll find a hot head. The head will be hot to touch. The rest of the body will be absolutely cold. Camphor has coldness, but the characteristicness is this, that it desires to uncover in coldness. You find the camphor patient wanting to throw off the covers, and they literally throw off the covers. In Arsenicum, though there is coldness that is there is an internal heat or internal burning. And there is a tremendous amount of internal burning in Arsenicum. So though external coldness, you will find internal heat. And this is where all the four remedies come very close. And all the four remedies are used in the starting as well as the terminal state of the illness of COVID-19. So physicals, you have in Gelsimium, dizziness, drowsiness, dullness, polyuria, and tremors. There is thirstlessness, there is air hunger, flatulence, and fritter. So you will find in arsenic and carbo veg, the odor is of, of the cadaveric and the terminal stage of odor that is. So there is a stench, a fritter that comes around, which, we identify with those who are in the, what I can say, terminal stage of the disease. Whereas in carbo veg, the food tastes salty. But very important, there is a bitter taste in mouth in carbo veg patients. It's only when the food is eaten, that's the time when the patient finds that there is a salty taste. Otherwise, just without like that, the mouth has a bitter taste in carbo veg patients. And the tongue will be indented tongue. Camphor, there is almost a complete arrest of breathing. Food tastes bitter and the tongue is bluish, which we saw last time. Arsal, collapsed state of pneumonia, cannot bear sight and smell of food. Dryness of mouth, drinks little but often. And there is a dry, clean, red tongue. That would be Arsal for you. And then, as far as temperature is concerned, Gelsimium is worse damp weather. Carbo Veg is worse warm weather. Camphor is coldest, but which is better by uncovering. And Arsal is chilly, but wants to be covered. Mentally, Gelsimium has desire for light, wants to be quiet. There is apathy to illness. Carbo Veg, anxiety, especially in the evening, which we saw around twilight time in bed. Indifference, hears everything without pleasure and pain. So similar to the apathy that we find an indifference coming around of neither to pleasure nor to pain. Darkness aggravates in camphor. There is insensibility of senses, restlessness, mental and physical. Arsenic, you will find a lot of restlessness, and with restlessness, you find weakness coming around. And because of the weakness, the patient is not able to move. But you will still find that some restlessness in the legs coming around because of the weakness. So there is mental and physical restlessness. And one of the trios of restlessness, Arsenic Album, Aconite, and Restox. One is totally mental, the other is mental and physical, and Restox is purely physical. And despair of recovery. Ars has come down to this particular understanding that he's not going to get well. Gelsimium is right-sided, Carbo Veg more useful for old age, and Arsal has upper third of the right lung most probably affected. There is a pain which goes around in the upper third of the right lung. This is a very characteristic symptom of Arsal. Time aggravation, Gelsimium has around 10 AM aggravation. It's generally morning time, whereas Carbo Veg is evening time. Camphor is when about to go to sleep, so when half asleep, and Arsal will be 1 to 3 AM. So the whole spectrum of timings are very, very different from in all the remedies. So one is before sleep, that is evening time. One is when about to sleep, that is camphor, when about to sleep, and the other arsenic will be when after sleep. So at 1 to 3 AM, Arsenic Album will have a problem. And Gelsimiums would be 10 AM aggravations. So they will wake up after sleep, wake up fresh, and then there will be a problem that comes around. So we complete the remedies for COVID-19. There are other remedies which are there, which we'll take up in at the next this thing when we start off. We'll take up with the early stages of the remedies that come around.